I'm hoping that someone can offer advice on suitability for lower eye bag surgery and what type. I'm a 38-year-old woman and always had dark circles under my eyes. Over the last year, I have noticed it worsening and bags forming, more swollen on some days. My eyes feel tired and itchy, there's pressure around my orbital socket, and my nose also blocks. I have managed hypothyroidism and have tested negative for Sjogren's, liver, and kidney problems. I have been prescribed anti-allergy nasal spray, effective on nose but not eyes. Can anyone offer advice? The bags keep growing. Many thanks.
Thank you for your question. You're 38 years old and you've been concerned about the appearance of puffy bags under your eyes, and you're asking for the best approach to dealing with this. And it's very good that you also included with your question some background about your medical workup and the fact that you do have some issues related to sinus and allergy. So at this point, I could certainly understand how, despite the management of the underlying eye, or I should say nose allergy situation, you're concerned that the bags keep getting bigger. So let's start by just understanding some of the issues that may not be fully addressed when you are being seen by medical doctors. As a cosmetic oculofacial plastic surgeon, I perform a lot of eyelid surgery and I have a lot of experience with this type of situation, and I'm in practice for over 20 years. So let's start with what we see on the photos you submitted. The lower eyelid puffiness is essentially something called lower eyelid fat prolapse. Lower eyelid fat prolapse is the fat pockets that are around the eyes that pushes forward. Now, very often it is a genetic issue, and that naturally it just happens. A lot of times it is not something that is related to sinuses or allergies and other things. Now, that being said, the eye and the nose area, the nose, the sinuses, and the orbit, the space around the eyes, all converge into a common area called the cavernous sinus, where fluid drains. When there is sinus congestion and allergies, it's almost like there's a traffic jam going back to that common location behind the eye. And because of that, the fluid tends to back up into the soft tissue around the space around the eyes, as well as the fat. So you can imagine that that no matter what happens, you will still have some fluid that'll be an issue given that type of scenario. And so ongoing progression of the fatty pockets can be related to some degree to the relapsing of fluid. Nonetheless, the basic anatomic issue is still the same, and that is there are fat pockets, I should say, that are pushed forward and causing these unsightly bulges. The typical solution that I offer patients who come to my practice in a similar situation is as follows. First, we want to try to maximize all medical therapy to try to optimize the surgical procedure that we intend to do. Surgery naturally causes swelling, and when people have issues with swelling prior to surgery, very often that does play a significant role in how fast the swelling clears after the surgery. So that being said, going to the eye doctor, the ophthalmologist, to manage any eye allergy issues, staying in touch with your ear, nose, throat doctor or allergist to treat allergy and sinus, and making sure everything is stable. Now, that being said, there are options as to how to address the lower eyelid fat prolapse, and they are surgical options. One is called a transconjunctival blepharoplasty, and that's a procedure where the fat pockets are addressed from inside the eyelids, and the other is called a transcutaneous blepharoplasty. And that's an approach where the incision is made underneath the eyelashes from an external approach. Now, in my experience, when people have issues with swelling, our goal is to minimize the trauma and to respect as much the natural anatomy of the lower eyelid to optimize the circulation. From my experience, the external approach tends to be more disruptive to the drainage system, whether it's the venous system or the lymphatic system. And so that leaves more room for potential long-term swelling after surgery. So in my practice, for someone like yourself, I would perform a transconjunctival lower eyelid blepharoplasty. In so many ways, this is such an elegant approach, basically going from behind the eyelid, not disrupting any of the support structure of the lower eyelid, or minimally disrupting, and strategically reducing and repositioning the fat appropriately. Now, that being said, there are other options to help with the skin quality and any of the other changes that have occurred to the skin, but doing that all in the context of the existing issue with swelling. Sometimes this has to be a stepwise approach. Very often we would even consider doing some type of anti-inflammatory management prior to surgery, during surgery, and even after surgery to try to minimize the swelling afterwards. The bottom line is you do have lower eyelid fat prolapse, and so how to strategically address it requires also a proper physical examination. So at this point, I would suggest you meet with qualified, experienced cosmetic surgeons who have extensive knowledge and experience with lower eyelid surgery and discuss the plan and options and how to deal with issues that could come up afterwards. I think it's still relatively straightforward. You've already done a lot of the baseline work to manage the sinuses and allergies. These tend to be very chronic conditions, so it's not like you can completely resolve the entire sinus or allergy issue completely. It's about more like management, like blood pressure management. That being said, meet with doctors who have this level of experience and expertise, and then make a decision to proceed in a way that you feel comfortable. So I hope that was helpful, and thank you for your question.